Cataracts are a leading cause of vision impairment for many older Americans. And while surgery remains the most effective way to help restore vision, post-surgical patient care is also equally important. Here now is internationally recognized cataract surgeon Eric Donnenfeld. Welcome.
Thanks, Elsa. Good to be with you.
I'm happy to have you here. So what can you tell us about the future landscape of post-operative treatment of inflammation in the eye?
Well, Elsa, cataract surgery is the most common operation performed in the United States, over 4 million a year. And these are on elderly patients, 60, 70, 80, even 90-year-olds. And as you mentioned, it's really important the patient gets their drops at the conclusion of surgery. If they don't get their eye drops, a perfectly performed cataract surgery can result in complications because of the lack of control of inflammation. And using topical drops is many times a burden for many patients.
So what are some of the biggest challenges in the post-surgical patient care? Is it just the drops or is there another part of it?
Well, the drops are the biggest problem for patients. Sometimes patients confuse their drops, they get them mixed up. They may not put them in their eye. They may put them in too close together so the drops wash out. Or sometimes they just don't have the manual dexterity, or they just forget to use the drops. And that's really terrible, that you can do a great procedure and end up with complications because the patient did not get their medications.
But there are new methods of delivering these drugs, right, for patients?
And that's what's really exciting, Elsa, is that for the first time, we now have a new innovative FDA-approved medication called DEXYCU, which is placed inside the eye at the time of cataract surgery by the surgeon, and it eliminates the need for using one of the eye drops. So the patient gets the medication, and it's slowly released over 3 weeks, so the patient doesn't have to worry about using the medication, and the inflammation is controlled by a medication actually placed in the eye. And this is the future of cataract surgery drops. We're not going to use drops as we know them now. They'll all be placed in the eye. It's just a better place to put the drops, and it removes compliance as an issue.
So that's the future. Is it happening now, and when can we expect it?
Well, that's a great question. It's been FDA approved, which means it's been through the rigor of an FDA trial, and it's being launched right now. And I've actually done a couple of cases now, and we'll be using it on all of our patients who are eligible for this medication in the very near future. It's going to be available all over the country, and it's exciting. It's really the future of ophthalmology you're seeing taking place right now in front of us, and patients love the convenience. It
really is exciting. Where can we go to get more information as we wait?
Well, if you're interested in learning more, go to DEXYCU, DEXYCU.com, and you'll get all of the prescribing information you need to learn more about DEXYCU.
Dr. Donnenfeld, thank you so much for being with us. Really appreciate it. We'll be right back with more Midday Maryland right after this. Stay tuned.